This is LiveWell Talk on a day in the life of a patient care tech. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's. Today's episode is a continuation of a series of podcasts we've done where we've sat down with team members and discussed their roles on a day-to-day basis in the hospital. As we've said before, the hospital is just not a building where doctors and nurses work. Medicine's a team sport, and there's a lot going on in any given day. And joining me on today's episode is Karla Woodman, a patient care tech with St. Luke's Hospital, to discuss the role of patient care techs and what they do on a daily basis. Karla, welcome.
Thank you so much.
How long have you been here?
It'll be 30 years in February.
I know you've been here as long as I have.
Mm-hmm.
And I think have you always been on 3 Center?
No, I started off on 3 West.
Okay.
Mm-hmm. Working with the folks that just got out of heart surgery.
Okay. I think you were on 3 Center when I came here in 2005.
Yes.
Well, I know what a patient care tech is, but just tell us what a patient care tech is.
Basically, we are hands-on with the patient. We help them with their daily cares as far as bathing, toileting, depending why you're in the hospital. You might need a little extra help. Maybe you've had a pacer or something and you can't use that one arm for a little bit. And we're not made to be, with one arm. Yeah. So, you need a little help. Yeah, so we help with that. Also, if the nurses maybe need an extra pair of hands for a dressing change, we can certainly help with that.
Yeah, and you take vital signs.
Oh, yes, absolutely, yes.
What kind of education or training does one need to become a patient care tech?
I would highly suggest certified nursing assistant, CNA, would be very helpful. That way you would kind of know pretty much if this is your cup of tea, sort of say.
Okay. Mm-hmm. And that would open doors not only for patient care tech, but other
of course,
jobs, of course. Yeah. Well, just walk me through your typical day.
Well, let's see, typical. Every day's a little different.
Yeah.
Every day's a little different. I try to, in the mornings, go in and put my name and the nurse's name that I'm assigned with. I'll put our names on the board, update the date on there. If they're awake, I'll greet them, introduce myself, and tell them, I'm here to help you. And if you need anything at all, please call. And, of course, be checking on them, hourly and just make sure everything's all right.
Now, and how many patients I know this varies, but how many patients are you responsible for?
Anywhere from 8 to maybe, and I've had as many as 12 before.
Okay. I know it varies.
It does.
You have 4 patient care techs or 3 patient care techs, and you have 36 patients. Well, each going to have 12.
Right.
That's pretty straightforward. Now, do you participate with ongoing learning and continuous education? How's that work?
Sort of. It just kind of depends.
I know we have in-services and all that sort of thing. Right.
That, of course, very important. I would say... I did get on with the skincare team going through the hospital quarterly. And that really opened up my eyes to a lot, how to prevent, because your skin is your first line of defense.
Well, and I also say it's the largest organ in the human body, and nobody's paying attention to it.
Exactly. Exactly.
So here you have an organ that's at risk.
Right.
What if your brain, your heart, your brain, your kidneys, somebody's paying attention to that. But the skin is kind of an afterthought.
It is, and it really shouldn't be.
I will say that after 27 years of practice, it's rare that you see a pressure ulcer like that someone has. Like a decubitus ulcer that needs to be debrided. It seemed like you always had 1 or 2 of those patients on your service back in the early 2000s. And I think we've just done a much better job of preventing those across the country. I think it's a better.
Yeah, it just kind of depends on the situation. All folks, different walks of life. Some are more sedentary than others. It just kind of depends.
If you're sick, so you're septic, let's say, and your blood pressure is low, it takes about 90 minutes for the skin to break down with pressure.
Yes, absolutely.
It's important.
It is very important.
Tell us what do you like the most about doing your job?
Oh my, it's the patient interaction. It's just so wonderful to meet so many different kinds of people, and I love people. I always have. So anything I wanted to do as far as a career, I wanted to make sure it was with people. I just really enjoy folks. It really makes me feel good to make them feel good, especially in a hospital setting where things are suddenly out of your norm. Maybe you're not in control or don't feel the control of your situation. Yeah. And it's nice to be able to, have a friendly face and say, hey, I know things are kind of hard right now, but we're going to do our very best to make you comfortable and help you as best we can.
Well, you're certainly good at it, that's for sure.
I thank you.
For the individuals listening to the podcast, and they may be considering taking a position as a patient care tech, because I know we have slots available or positions available. Mm-hmm. Tell us why they should choose that for their career.
Well, like I say, if you love people, one of the highest compliments I can have from a patient is if they have to come back to us and they remember me. That just makes it so worthwhile, because I'm an open book. I share everything with my patients, where do you live, or, you have kids, and, I just share everything. And so I have a special needs son that lives with me, and they'll be like, how's that son of yours doing? How old is he now? Yeah. Oh my goodness. That just really thrills me. Yeah. If I've made enough impact where somebody remembers me, that's like, wow. To me, that makes it worth it. It's really awesome. Worth it.
I know when my aunt was in the hospital, who she subsequently has passed away, but she had a lot of medical problems. Mm-hmm. But between the environmental services and patient care techs, she knew all their names. Yeah. They knew everything about her. Mm-hmm. I mean, because she was in so frequently,
right.
And she really did enjoy their company,
mm-hmm.
And that was very nice.
Absolutely.
Karla, thank you for joining me and sharing about a day in the life of a patient care tech. Once again, this was Karla Woodman, a patient care tech with St. Luke's Hospital. If you're interested in a career as a patient care tech or any other role at St. Luke's, visit unitypoint.org/careers. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.